ABC7 is committed to building a better Bay Area, which includes focusing on your health. For one East Bay couple, the challenge of giving birth during a pandemic was complicated by a high-risk pregnancy due to the baby's rare genetic disorder. ABC7 News anchor Amma Dates has their story.
Amanda and Jeff Gilmore got married in 2018. The couple found out in 2019 they were going to be first-time parents. But about 16 weeks into the pregnancy, they got news something was wrong.
We went into doing further testing and found the trisomy 13.
Trisomy 13 is a rare chromosomal abnormality associated with intellectual disabilities, heart defects, even death.
It's just scary because, you know, obviously there's billions of people on the planet, and so you see all the success cases and all the good stories and things, and you don't expect yourselves to be one of the, small percentage of people that come across an issue like this.
Only 5 to 10% of infants with trisomy 13 survive to age 1.
We wanted to give her any kind of fighting chance that she had.
Having a high-risk pregnancy is challenging enough. Having a high-risk pregnancy during the coronavirus pandemic has been difficult on another level. Jeff hasn't been able to join Amanda for checkups.
I mean, pregnancy brain's real. And so when I'm in there and I'm just distracted by so many things going on, I love having Jeff there to really say what I can't sometimes vocalize.
Another impact of COVID-19, family and friends won't be able to visit after the baby is born due to social distancing precautions.
If her time is limited, that we couldn't have family there to be there with us, and that she may never meet, her aunts and uncles and grandparents.
Dr. Timothy Leach is an OBGYN at John Muir Hospital in Walnut Creek. He says the hospital is taking extra safety measures because of coronavirus.
All staff, clinical and non-clinical, patients and their support persons are getting screened with some COVID questions. They're getting their hand sanitized, and they're getting a temperature screen before they're allowed in the hospital.
One day after our interview, Amanda, who tested negative for COVID-19, was brought in for an emergency C-section.
And about 12 doctors and nurses. Since it was high risk, they had every position there.
Amanda and Jeff welcomed baby Riley into the world, weighing in at 4 pounds 2 ounces and measuring 17.5 inches.
When we were in the NICU, her second day of life was actually probably the most dicey that we experienced, where she was having these apnea episodes every 10 to 15 minutes for 7 hours. We thought that was it.
Despite the scare, the couple said hospital staff took care of them and were like family, especially when visitors weren't allowed. After 3 weeks in the NICU, Riley finally went home.
It's really scary, but really exciting.
Riley has apnea, and she's connected to a feeding tube and an oxygen tank to help her breathe. 24 hours a day, 7 days a week.
Simple things like the common cold, can often be deadly. So we have to manage that. And then you throw COVID on top of all of this.
Prior to the birth, Amanda and Jeff were worried loved ones wouldn't meet Riley. But now,
have friends and family meet through our sliding glass doors. We're
very thankful to have
one of those, so they can get, up close and personal and see her there through the door. But, otherwise.
Different.
What's next for the Gilmores?
It's just continuing to enjoy our time with her. Every day's a gift.
Amma Dates, ABC7 News.
Every day is a gift indeed. Amanda and Jeff say Riley is a fighter. Amanda says any parent who receives a trisomy 13 diagnosis during a pregnancy may feel isolated. But she says after talking about it with her family and friends, she and Jeff received much needed love and support. Glad to see them all smiling.
Yeah, love to see that smile at the end of the piece from baby Riley. Best of luck.